So today we're going to go through your class packet for your injectable and sequential upcoming cycle. When you come to class, you're going to get a packet just like this. It's going to have all your instructions in it. Pretty much we're going to go right down the list step by step and tell you what you need to do. If you haven't already started taking a prenatal vitamin, it's a good idea to go ahead and do that. Anything over the counter is fine. It doesn't need to be prescription brand. When you have a positive pregnancy test, the OB that you end up with will give you a prescription for something specific that they want you to take. Second on the list is to talk to someone in our financial department just to find out what's covered as far as your in-office visits, your blood work and ultrasounds and things like that. We request that you do that prior to your baseline ultrasound. They are open Monday through Friday, 7:30 to 4. You can walk in and speak to someone anytime. You don't need to make an appointment to speak with someone in financial. The first big thing that you have to remember is to call us when you start your cycle, days 1, 2, or 3. We do baseline ultrasounds. We count day 1 as your first day of full flow. So if you spot for a few days beforehand, you'll wait to have that first day of full flow, call to schedule the baseline at our front desk number, and they'll get you scheduled for something like that. The baseline ultrasound is very quick. We just want to take a quick look at your ovaries, make sure there's no cyst, take a quick look at your lining, make sure it's nice and thin, and then if everything looks great, we'll have you start your medications on day 3 of your cycle. Now, some of you are doing a combination of oral medications and injections, and that will be written on your packet specifically telling you which days you need to do which medications. Those of you that are doing straight injections, same thing applies. It'll tell you exactly what days you need to do your medications and what days you're going to return to us. Some of you will return to us on day 7, some of you will return to us on day 10. During that second ultrasound on day 7 or day 10, we're going to take a look at your ovaries and see how much they've changed in the time that you've been doing your injectables. After you've taken your injectable medication for 5 or 6 days, you'll be instructed to take your ganirelix or antagon, and we'll tell you exactly how long you need to take that and when we're going to see you back. Once your follicles get to the appropriate size, we'll have you take your Ovidrol injection, which is going to make you ovulate. We'll instruct you what time you need to take that, and if you're coming back into the office for insemination, we'll have you schedule that on your way out. After your Ovidrol, you'll start progesterone suppositories. They are vaginal suppositories. You'll get them as close to your cervix as you can. You'll put them in the last thing you do before you go to bed. Pad or liner is probably a good idea since they do melt with your body temperature. By the time you wake up in the morning, you shouldn't need any pad or liner. It should be absorbed by then. You'll do those for 14 days. At that point, you'll come in and test for pregnancy. If you test positive, we'll have you continue progesterone for minimally another 2 weeks. When you come to class, we'll order your prescriptions at that time, so make sure you check with your insurance company and find out what your medication of choice is, and if you need to go to a certain specialty pharmacy, we'll order all your medications at that time, and we'll also sign your consents for all your meds and your insemination if that's what you're doing.